Hi, this is David Parra with AARP in Arizona, and today is the conclusion of a 12-episode series on long-term care. We have covered a lot of ground, and I'm going to be doing an introduction, but before I do, I have a special guest with us today, and I would not like to keep her, in the waiting room. So let me introduce our special guest today, Lindsay Bush. She is a licensed clinical social worker and contracted nursing home coordinator for services geriatric extended care for the Phoenix VA. Lindsay Bush, thank you so very much for joining us.
Of course, happy to be here. Nice to see everyone.
All right. Well, I'll come back to you in just a second. I would like to just do a kind of an introduction, being that this is the last show of this series. And let me go back to the PowerPoint. Basically, what we have done is this is the 12th show. We've covered long-term care in our healthcare system, acute care versus long-term care, the what, the who, and the where of long-term care, home health versus home care, the cost of long-term care, Medicare and regular health insurance, long-term care insurance, public programs, and then we did 3 shows on the Altex program, 1, 2, 3. And today we are going to conclude by covering services offered, and let me be more specific, long-term care services offered by the VA, and that's why we have invited Lindsay and Bush. Let me just say a few more things, Lindsay, and then we'll get to the conversation on this important services to veterans.
Sure.
Just to review, when we talk about long-term care services, we're talking about a range of services and supports that help with activities of daily living. I'm not going to go over everything because, again, this is the 12th show, and I basically repeated these definitions on every show. These are activities of daily living and then also instrumental activities of daily living. This can happen, this can happen at home. This can happen at the community support, as community support services, obviously in the community, and of course outside the home, such as nursing homes and the like. So these are some of the definitions that we've used over this 12 episode series. And then, of course, the cost, right? The cost, how to pay for it. We cover some of the elements that may include Medicare, regular insurance, of course, long-term care insurance. Then there are public programs, Medicaid, more specifically in Arizona, Altex, right? Then the VA, and then personal resources, of course, people that don't qualify for public programs, they pay with savings, life insurance, annuities, reverse mortgages, and trust, and the like. So this is a service that is not it's not necessarily integrated into our healthcare system in America. It is a very you have to basically navigate the system to acquire services. But today, in the concluding show, we are going to be talking about those services, long-term care services that are offered at the VA. I have to say that I hope that I'm using the terminology right, the veterans, right, Lindsay? And again, Lindsay Bush is our special guest today. So I'm going to ask you, Lindsay, to take us through what are these services that the VA offers and kind of go over the details as to what they are and who is eligible, how to apply, and why not resources. So take it away for us, if you don't mind,
Of course.
Lindsay.
Perfect. Well, hi, everyone. Again, my name is Lindsay. I'm a social worker at the Phoenix VA Hospital and happy to be here and explain the programs. The VA can be very complicated for a lot of people, but, I think we offer a lot of great resources and we have a lot of awesome resources for veterans, especially in the long-term care world. So just being aware of those resources and how to go about accessing them, that's what we're here for today. So a little bit about what services we offer in terms of long-term care at the VA. We love to use our acronyms at the VA, so I'll go over those. Sorry if I get into my acronym mode, but Dave, please let me know if you have any questions
No
along the
problem,
way.
no problem.
So we have our contract nursing home program, which allows for skilled short-term services or long-term care services in the community at our contracted nursing homes. And our veterans who are 70% service connected and greater would qualify for those services free of charge. And the service connection is something that is established through our Veterans Benefits Association, and it's in relation to service-connected disabilities you endured during your time in service. So that could be PTSD, it could be a heart issue, different things like that. And so that qualifies you for the long-term care at the nursing home free of charge if you're 70 plus. So if you're getting services through the VA, it's a pretty awesome benefit that there's no share of cost, unlike Alltex where you have a share of cost. No share of cost if you're 70% or greater. So if you're a veteran and you've never applied for your service connection, I would suggest reaching out to the Veterans Benefits Association and just seeing if you qualify for anything, because you could be entitled to a lot more benefits there. And I do include the Veterans Benefits number at the end of this presentation as well. We have our Community Living Center, which is at the Phoenix VA Hospital. We did used to have veterans that lived there long-term care. Now it is only a skilled and hospice bed facility, but all veterans qualify that should they need those services, and they're in our VA hospital. So our Arizona State Veterans Home, which is behind the VA hospital, that is a long-term care and skilled nursing home. So again, our veterans that are 70% service connected or greater would qualify, as well as the Alltex. They do accept Alltex as well. And then if you just need a little rehab or a skilled care stay, you're rehabbing from a knee injury, something like that, you need to go there. You can use your Medicare to go there as well. And we'll talk about how to get in there. Usually it's through a social worker referral. If you're in the hospital, the social worker would be helping you. If you're at home and you feel like you need long-term care, or you have a loved one that's a veteran that you can no longer meet that level of care, you can reach out to your outpatient social worker, and I'll tell you guys how to do that as well.
So, Lindsay, let me
Yes.
ask you, so
Yes, sir.
veterans, do most of the veterans already use veteran services of some sort, or could there be scenarios where some veterans are not, and then they will have to go to the VA to start the process of acquiring those long-term care services?
Yes, you are exactly right there. So we have a lot of veterans in our community that prefer to use their different insurances. Maybe that's TRICARE, it's Medicare for their primary care, and so they're not established with the Phoenix VA. But in order to be eligible for these type programs that we're explaining, you do need to be established with a primary care physician at the VA. So we do have a lot of veterans that like to do both. Like maybe they're getting adult daycare services from the VA and maybe some respite in the home, but they still prefer to see their outside primary care under their Medicare. Totally fine. You just need to be established and kind of in our system. So it's
And
good to
let
kind of
me
just go ahead, Dave.
Yeah, let me also ask you, so just
Yes,
because
sir.
I think the conversation is good, and I think not
Yes.
knowing on my part will
Mm-hmm.
probably be a good situation because my questions
Definitely.
could be somebody else's
Oh, for
questions.
sure. Yeah, I'm
Yeah,
glad you asked that.
right. So basically, are we saying that there are some long-term care services that could be offered at the VA setting, and some may be offered outside of the setting?
Correct. Yes.
Okay. Now, are there any that could be offered at home, at the
Yes.
person's home? Okay.
Yep. And again, you would just want to establish the cares through the Phoenix VA first, but they do offer in-home care services if you're medically eligible, which either a nurse or a social worker would do like a quick little review of why you needed those services at home. But we have some great programs at home. We have respite services available in the home health care, nursing. We have a home-based primary care team program if it's hard for you to leave the home, which is a team of psychologists, doctors, social workers, nurses, everyone that can come in, caregivers, and provide you the help that you need in the home. We also have our caregiver support program, which is really awesome and expanding. I included that number here on the slide, where you can
Hmm.
do a direct referral if you're already in our Phoenix VA system. And so they offer additional to supports for caregivers caring for veterans at home. So this could include possibly a monetary benefit, other services, either free of charge or low cost, depending on the veteran's income. So all of
So
these
another
services.
Yeah,
Go ahead.
another question, Lindsay, and I'm
Yes.
sorry for we're not in the same
No,
place. So I'm
no,
sorry that
no,
I keep interrupting.
no,
So
no, don't
would
say.
you say that a veteran who potentially will need a long-term care
Mhm.
services should consider the VA almost like as their first go-to place?
I would say so. Yes. Yes. Just to
Mhm,
have everything available to you, because we do have several veterans that maybe have all text too, or they have
mhm,
possibly private long-term care insurance, but that way they have all their options open to them. And we offer different facilities than Altex does. If you are a veteran and you are that service connected at 70% or greater, you're not paying anything. So it offers a lot of great options. We do, and I can go over that later too. We don't cover assisted living level of care, unlike
uh-huh.
Altex. But we do offer some benefits through our veterans benefits called aid and attendance, which is an additional monetary benefit you can apply for that will help pay offset the cost of assisted living or
And
staying at
now
home even too.
let me see if I got this right, because if
Mm-hmm.
if I got it right, it's unbelievable. So having done this with this one 12 shows, I learned a lot about the
Mm-hmm.
long-term care. And are you saying that veterans will not have cost sharing, that they will get this long-term care type of services pretty much free of charge?
If they are that 70% service connected and greater. So that's the key factor. So
Okay, can you explain
mhm.
that? Because as a non-veteran, I don't understand what that means. Would you mind?
Yeah, no problem at all. So the service connection is again a service connected disability that you maybe
Okay,
received in your time of service,
got it.
whether that be related to Agent Orange, diabetes. We see a lot of PTSD, things like that. Even mental health disorders. So usually when a veteran is getting out of service, they might connect with the veterans benefits to see if and that service connection is something that they're getting monies for. The VA
Got it.
pays monies for those benefits. So most veterans, I would say, if you haven't applied, apply for it, or you either know or you don't know if you're service connected. But that's something that the VA can also help you with. So you can start with calling and getting that primary care intake appointment, even if you choose to use your private doctor that you've seen for years, but you're like, hey, I would like some respite or a little more help in the home that Medicare this or that can't provide.
And another thing that I'm learning is that you can help people or veterans who have other type of insurance too, which to
Yes.
me is great, because the
Mhm.
more the better. I can't
Exactly.
imagine how difficult it is to navigate this type of care, and I think it's great that the VA can, even if they're not necessarily using only the VA service, you can still provide
Right.
more information at the very least, so that
Exactly.
the veteran knows that he's been, or he or she's been taken care of in a good way. Uh, um,
Exactly.
Lindsay, tell me if I need to move on to the next slide. Are we okay with this one? Should we move forward?
Yes, we can go ahead and move forward. Thank you.
Perfect. Okay, so how do I access these services?
hmm And I think we went a little bit about that,
Hmm.
but in order to access any of the VA cares, any of our programs, adult day health care, contract nursing home, respite in the home, caregiver support program, you want to be enrolled with the local Phoenix VA.
Okay,
So we have our number up here that you can call our primary care physician intake center. And get set up. They'll probably want to know like your basics, your social security number, and things like that, so they can pull you up in the system. Once you're established with a primary care physician, you'll be assigned to a primary care team, which is nurses, doctors, aides, and a social worker. So your social worker, once you're assigned to a doctor, we also have unassigned, meaning if you're pending an appointment but you still need to access services, we do have a social worker too that can help you along the way once you get initiated with the VA. But your PACT social worker or primary care team social worker is going to be your point of contact moving forward. So that person's going to help you with any help in the home, if you need to do a shorter long-term term care stay, how to do that, how to go about that process. If you are going to have a copay for something, that will be the person that will help you figure that out. Or if you're service connected and you're not going to have any, they will let you know. And they might be able to tell you, go through an assessment with you and see, hey, you could benefit from this. Are you interested in this type of program or that? So they really are your key point of contact once you're established. And then if you don't know, so we have a lot of veterans that maybe they've seen a doctor years ago, and technically they're still assigned to a social worker. So you can always call our social work department. I put the extension there. And Patrick in the office will let you know, hey, oh, you're actually assigned to Dr. So-and-so, and this is your assigned social worker. Or you haven't been here, you're now technically unassigned. We'll get you set up with a new physician here.
Perfect. But this is great information. I'm telling you, very, very good
Oh,
information. Thank you
good.
so very much.
Of course.
Yeah, let's, should I move to the next slide now?
Yes, please.
And from what I gather, Lindsay, there's really no wrong door, correct?
No.
Anybody who contacts the VA will be guided to the right type of service and the contact they need to see the department or area or what have you, correct?
Correct. So if you call our main line, which is that 602-277-5551, and press 0, it will go to the operator. But really, I say go to social work, because if you don't know what you need or where you're going, we will help you figure out the right way. But again, if you haven't established care there, we can tell you that, or you can call that primary care intake extension 2 to see. But yes, someone there should be able to guide you. Hey, I want to get services. I've never been here, or this is what I need. And they should be able to look you up and figure out where to point you in the right direction.
Now, I know you probably have said this twice already, but let's
No.
just do as a standalone,
Sure.
real clear here, not in the middle of sentences, but just straightforward. What are those specific long-term care services that VA offers?
So
Again.
specific long-term care services that VA offers is our contract nursing home program.
Okay.
And you would have to meet, eligibility requirements, which we spoke about before the service connection. It would require referral from a social worker as well. But the long term, yes, we do offer the contract nursing home long term. Also, our adult day healthcare services, and I think we have a couple slides coming up on that as well. But our adult day healthcare is an awesome benefit that we have several adult day healthcares in the community. Small copays depending on your income, possibly free of charge for a lot of our veterans with low income. I think the max copay for adult day healthcare is like $15 a day. So that's really good respite. You could, if you're a caregiver and you have someone that meets those criteria, 9 to 5, so, and then we also offer the respite services in the home health care ongoing. So unlike Medicare, where sometimes they have a time limited, if you qualify and you're needing a nurse to come out once a week to check your vitals and set up your pill box, and you need a caregiver 3 times a week, we will continue to pay for that, just kind of like all techs. We will continue as long as you're needing those cares. We will continue to pay for that. And again, you do so once you're established with the VA, and let's say you need some respite help in the home, you would do what's called a means test, and it's just going over your income. And then it would say, oh, you're copay exempt. So we would let you know you have no copays, or we would say maybe you have a $10 or $15 copay. I can't remember how much it goes up to per care, per service, or per episode of care.
But relatively low, I hear.
Yeah. It seems like the veterans that I know that do have copays is pretty low. And at this time, although of course with COVID things change daily, but at this time we are not having copays due to the pandemic.
Great.
So
now I know AARP did, I want to say, if not 3, at least 2 teletown halls about the Be Connected program.
Oh, okay.
Would you mind telling us just a little bit about the Be Connected resource, the Be Connected program?
Sure. And I included the website on here and their phone number. So I've just been given an in-service too with the Be Connected program. It's an awesome line. I've actually used them a few times with some veterans in the community that were maybe low income or homeless or needed some additional resources. We do have a lot of those type programs at the VA as well. But they're just, again, if you ever had any problems like accessing our main line, extension 0, or didn't know where to go, they are a good start as well. Because, they're very familiar with all of the VA hospital resources, and then they have additional resources past the hospital that we might not be aware of. That can help, veterans and their family members too. So really, they've been great to work with. The few times that I had to work with them, very easy to work with. Contacting that phone number, again, you can call the support line anytime anonymously. Just ask for any additional support and resources, and they'll point you in the right direction.
Perfect. So let's see.
Yeah.
Now, if you can just, I know you've already kind of talked about the different services, but you have a slide here very specifically to the community nursing home, if you want to cover
Mhm.
just anything you haven't covered yet.
Sure, sure. So a community nursing home or also our contract nursing home, again, is a place where someone, a resident or veteran, would live long-term care. They need skilled services that can't be met at a home or sometimes a group home or assisted living environment. So again, that referral would come from your social worker, and they would provide you our list. We have 24 community nursing homes around the valley. And that changes. We're hoping to get a little more on in our East Valley and continue to grow as our program gets larger. But that is kind of my role in our team. Once our veteran is in one of our community nursing homes, we provide oversight, visits, make the payments, all of that good stuff, and make sure that they're receiving the care that they need. If they have problems there, it just kind of like all techs are assigned a case manager, so you have someone to go to if you're having issues that can't be resolved where you're at, or you need additional help, things like that.
Now, you mentioned the valley. If this video is watched outside the valley, outside of
Uh-huh.
Maricopa County, so how is the VA structure in the? Is it by cities, by county, or how somebody like say in Pima County would access VA service, the same VA services that you are describing to us here?
So they would go to their closest VA hospital. So we
Okay.
kind of have it split up by north, south, and then so the Maricopa and the surrounding counties. We actually cover Pinell and Gila counties too. So our program will go out to Payson. We have a facility out there in Prescott. And we often interlap to intermix. So we have some Prescott veterans that are coming down here for care if there's no availability up there and things like that. So Prescott VA Hospital, Tucson VA Hospital. And then we have they call them C-Box, or they're the clinics.
Mm-hmm.
So you've probably seen them around town. And we're actually getting another super clinic downtown, I think in the spring, which will offer additional services. So that's somewhere good to go where they have the primary care physicians, additional services, but not at the hospital setting, because the hospital can be quite busy at times. But yeah, so if you're not familiar and let's say you live in Prescott, you're a veteran, and you want to know about these things, just call the main hospital line in Prescott VA, and they can help set you up in that way as well.
Perfect. I have the slide about the adult day health care. If you can just anything you haven't
Mm,
covered about this one, if you don't mind.
sure, sure, of course. So we also have our adult day healthcare program, and again, referral would start through your primary care social worker. It is for veterans that need help with some of their activities of daily living, which I see you guys have kind of gone over a little bit as well.
Mm-hmm.
Maybe you're caring for somebody that has dementia or something like that, and you're working, or you just need a little bit of respite. This is a great program. Our veterans just excel. They love this program, and we were very sad for a while when they had to close due to COVID, but now pretty much they're all open.
Great.
And it's great. They can go up to 5 days a week, half days, all day. And again, the copay would be based on your income levels, and it's all service connection approved. So any veteran can apply for that program.
Right.
Um,
I have you covered some of these points because we don't want to go too much into the details of
yes,
the application
right.
because we really want folks to really call and then get the process
Yes,
going.
get the
Anything that you
basics.
want to say on this slide?
I don't think so, but Dave, if you could go back, I think there was a slide called Veteran Resource Center. I
Let's
just want
see.
to touch on real quick. I think it was right before this one. There it is.
Okay.
Just wanted to make all the veterans aware of our Veteran Resource Center too, since it's fairly new. It's at our VA hospital, and it's kind of it's a great resource. So open Monday to Friday, 7 to 5. They accept walk-ins. So any issues with bills, eligibility, like if you're near there, you can always walk in and apply then for any benefits. And they also have a social worker as well there that can help with services. So if you're at the hospital for some reason and you want to know, I should go to the Veteran Resource Center. So they're also a great resource we have. So thank you.
Perfect. So let's move back then to the program overview. I think you cover this one pretty much,
Yes,
right?
I think so.
Okay.
Yes.
Yeah. Service population, anything there?
I don't think so. Again, we kind of went over it. In order to be eligible for our community nursing home or adult day healthcare programs, you have to be, require assistance with 2 or more ADLs, similar to what you would need for all techs and things like
Right.
that.
Perfect. Now we're talking about this eligibility. Anything there, because I know you've covered most of this information.
Yeah, I don't think so. I think it's just starting, making sure you're in the VA system, and then from
Hmm.
there, they can, because there's so many different caveats at times with the VA. Like generally for our long term care nursing, we would cover everyone 70% and greater, but we also do cover 60% with one area. So it's kind of detailed there. So I would just say, like you said, Dave, start with establishing cares with the VA, and then your social worker will help you from then on.
Perfect. This would be about the same, but
About the
in
same,
relationship to
exactly.
the adult day health care, the
Right. Kind
eligibility
of
is
our
there.
details on
Perfect. Yeah, and the anybody watching this video, you can pause the video if you want to read the nitty gritty of these points. I think Lindsay has done a great job in covering them before, but feel free to stop the video here or pause it and read those points if you're so inclined. Then how does one apply? I think you also have said
Yes.
that, but it doesn't hurt to mention it again.
Yeah, exactly. So, how do you apply for these programs? And that is to include, also the home health care, things like that. Just start with your primary care team, your social worker. We also we have something called My Healthy Vet, which is if you're established cares with the Phoenix VA, you can go online and look at all of your records online and actually leave messages to your doctors and care teams online. So a lot of our veterans prefer to just send like a quick message. So you could also communicate that way once you're established with cares, which is nice.
Perfect. Let me see. What else do we have here? Well, questions. This is if we
Mhm.
had a live audience, right? But
Yes, yeah, kind of.
anybody who's watching this video, if you are so inclined, you have a question, go ahead and include it in the comments, and we'll keep an eye on those comments and
Yeah.
get back to you with any information that you might have. Well, I think we have come to the last point, and I really, really want to thank you, Lindsay. We work
Of
hard
course.
to get this
Yes, we
this
did.
presentation, and I am so glad
Yes.
that. And I wasn't sure if I wanted to end it at the number 12, but I think we have
Mhm.
covered a lot of information about
Yeah.
long-term care services, and I am so glad that
Yes.
we are able also to cover the VA. Any final thoughts before we conclude, Lindsay? And actually, we're going to make it in less than 30 minutes. Go
Oh,
ahead.
very good. I don't think so. Just I would suggest anyone to reach out to the VA. You don't have to get all of your care there in order to access some services. We just ask that you see a primary care physician there once a year. But we offer a lot of great long-term care resources that aren't available, through Medicare and things like that. So it's nice, like Dave said, to just have all of your options open to you, so you know the best way to go. Thank you for having me, Dave.
It's a pleasure, and I hope that we can do more programs in the future. Lindsay
Definitely.
Bush, licensed clinical social worker, and she works as the coordinator for contracted nursing homes, Phoenix VA. Thanks once again, Lindsay
Of
Bush.
course. Thank you,
Thank
guys.
you.
Have a great day.
Yeah, and thank you all. Thank you all for joining us in this series. We really hope that we did a good job in informing you what it entails, what this long-term care services entail. And we really trust that you enjoyed it and share it with friends. And thank you so much. And we'll be back with other topics. So thank you again, Lindsay, and thank you,
You're
everyone.
welcome.
And see you soon. Take good care of yourselves. Bye-bye.
Thank you. Bye.